At DT, we've developed a mental health framework to help support our people who may develop mental health problems. We've taken a fairly standard public health approach of primary prevention, secondary intervention and tertiary rehabilitation. And what we aim to do is create products and services that we map onto that model in order to support our people better. A key part of what we do is the training and education of our people in mental health, and we do that at multiple levels. So we firstly promote general mental health awareness, what mental health issues mean, what one can do to avoid problems and what one can do to build one's own personal resilience. We then specifically train our people managers, and the intention there is to give them the tools to recognise the early signs of distress in their people and then to signpost support services to help them to get better faster. And finally, we engage with our senior leadership population. It's important to get buy-in at that level, not only to provide the resources for what we do, but also to help to create an environment in the organisation that promotes well-being and avoids harm to our people. In terms of the sorts of impact that we've seen, perhaps the most important one for me is that we've seen a significant reduction in the stigma around mental health. So whereas a decade or so ago, people would often be very reluctant to talk about mental health problems either in themselves or their family or a member of staff, these days conversations are much more open, and that provides for a much healthier organisation. We also track tangible outcomes such as things like sickness absence, and what we've seen over time is a reduction in the amount of sickness absence that can be attributable to mental health. It is something that you have to do in the long term. It's not the type of issue where there's any sort of silver bullet. You do one thing and it solves all your problems. What you need to do is engage with your people at multiple levels with multiple interventions, and that's why we've created a framework for mental health. And the aim is to ensure that we cover all the different aspects at different stages in the life course of potential illness. Perhaps the other key thing is to engage properly with stakeholders, and that means getting buy-in from people within the organisation at every level. Getting top-level leadership support is absolutely critical, but so is getting support from those on the front line. And we, for example, are a heavily unionised company in the UK, and working collaboratively with our trades unions was a very important element in developing our programme. And finally, my tip would be don't forget the middle. Middle management are the group that frequently find themselves in the sandwich of pressures from coming up from below and coming down from above. So to make sure that you engage middle managers who can be huge help in translating policy into practice, but if you neglect them, they can also be a significant barrier to progress.